Well, India's neighboring countries are on high alert as the South Asian nation suffers a COVID-19 surge that might have been driven by a new variant. Trisha Tarada joins us now. Trisha, what do experts know about the India variant and what is the government's plan in a worst case scenario?
Well, the government is taking steps to prevent a scenario like what's happening in India, according to Malacanang. First is the travel ban. It's currently looking into World Health Organization's input to include other places where there is a lot of movement involving passengers from India. Treatment czar Bong Vega says the IATF is very well ahead in terms of making sure that variants will not spread or will not replicate to an extent that it will be having a hard time in terms of the healthcare capacity. Vaccine expert Nina Gloriani warns that the new variant from India may have higher transmissibility rate and its impact is quite different from previously discovered variants. Gloriani hopes it doesn't affect the entire country, but the vaccine expert says it would be unfair for critics to say that Philippines is doing worse compared to India. She notes the mortality rate in the Philippines is low, and aside from the variants, she attributes the spike in the country to complacency of some people.
Nag-flatten tayo ng epidemic curve. Tapos by February, March, ayun, umakyat na naman po kasi marami na rin pong naging lax. So I think that is unfair to say that. And siguro hindi naman din kasi yung sa India naman nangyari dahil din po siguro yung kanilang mga religious festivities tapos yung kanilang double variant ngayon na we hope wala pa po sa atin. Mukhang malakas yung tama ng double variant na yon in terms of higher talaga po ang transmissibility niya at base do sa mga naging press releases ng kanilang mga eksperto actually kagabi, sinasabi na kahit mga bata ay medyo severe, medyo ibang klase po sigurong variant ito than what we would normally get from yung UK, yung South Africa. Medyo kakaiba.
And while there is a travel ban, the government is continuously expanding the healthcare capacity to accommodate COVID patients. The palace says despite improvements in the healthcare capacity in Metro Manila, it won't stop with 1,000 ICU beds and it will continue building more. Back to you.
Trisha, in what way did the healthcare capacity improve? And does this mean government is ready to lower the quarantine classification for NCR+?
Well, that's possible according to Malacanang as the healthcare capacity in NCR and nearby provinces, particularly the ICU occupancy improves. Vega says they were able to set up additional 357 ICU beds. So from 781 critical care units in March, there are now 1,148 ICU beds in Metro Manila. Presidential spokesperson Harry Roque says healthcare utilization rate is one of the most important factors in deciding the quarantine classifications. Based on official data from DOH, the current healthcare utilization rate in Metro Manila is at 50%, but Vega and Roque reiterate that the IATF will still have to observe the daily attack rate and 2-week growth rate in the coming days.
I think that with the additional beds that we have provided, I think pagdating po ng 14 at the end of the MECQ, there will be confidence in announcing another qualification, for classification for Metro Manila and the surrounding provinces.
We still have to make sure that the number of cases has really decreased, and that our efforts to suppress the virus is there, and the transmission rate is below 1 or even below a minimum figure to make sure that the virus or the variant doesn't replicate.
Malacanang encourages the public needing medical help to contact the One Hospital Command Center at 15555 for hospital referrals. Back to you, Pia.
Trisha Tarada there reporting.